Welcome to Two Pete's in a Podcast, where we will talk about child health from birth right away through to adolescence, dealing with issues of illness, development, and everything else that is of importance.
Hello, and welcome to our second part in Runny Noses. I am Michael Platten, and with me I have
Simon Strawn. Hi, everybody. Nice to be here again.
Hope you enjoy what we're going to talk about. So today we are going to be covering why is your child's nose runny? And as part of that, we're going to go through the symptoms, the associated things that happen with the runny nose, and then we'll also talk about an upper respiratory tract infection or like a sinus infection and what to expect, the normal progression, how to basically manage it, and then with the next podcast we'll go into the treatment of that, and then the fourth and final podcast will be on our warning signs. So, why is your child's nose running? The most common thing that we see is that a mom will come in and say, my child has flu, or the whole family has flu, or they went to school, they came back, and then they got flu. So what is flu actually? Flu is an upper respiratory tract infection, or like a common cold. And there are a couple of viruses that cause the common cold, the most common being, Simon?
Rhinovirus. And I think that this is an important distinction to make. When you talk about flu here, this is not what you get your flu shot for. So when people talk about flu, they're actually talking about upper respiratory infections. But when we talk about flu, we're talking about influenza.
Yes.
So rhinovirus is a group of viruses, and there are over 100 different types of rhinovirus, and they cause the common cold. And that's why everybody gets a cold once a year, because you don't necessarily develop a level of immunity to every single rhinovirus. But I think the important thing is that unpacking how long one of these rhinovirus common colds last, and calling it a common cold doesn't diminish the fact that your child is quite terrible.
Yeah.
And it starts with a runny nose, often with some sneezing and a sore throat. And that lasts a day or two. And then the mucus starts to become quite thick and yellow. Now, why does it take that long? Because our immune system immediately picks up that there's a virus in the nose and will respond by increasing the amount of snotty stuff that comes out and causing a bit of a sore throat. But it takes about a day or two for our immune system to absolutely identify what it is. And that's when it kicks in with this thick, yellowy mucus that comes. And that doesn't mean that there's a serious infection that needs to have an antibiotic. It just means that the immune system's functioning properly. And over the next 2 or 3 or 4 days, this mucus is in the nose. The child starts to cough. There's often a low-grade fever. So what do we mean by low-grade? Usually 38.5-ish, around about there. But that takes about a week. From starting off with the runny nose, sore throat, itchy, sneezy, to thick, congested, bit of a fever, that head cold feeling we all know about. And then things start to improve a little. The head cold feeling starts to disappear. The nose starts to clear. But you still cough for another week. So it takes 14 to 18 days. Yeah. Mike? And I mean, regardless of what you do, it's still going to take that length of time.
So the nice summary that I give my moms is that your child's going to get exposed on day 1. And normally within about 48 to 72 hours later, they're going to start with their symptoms. And that's a clear runny nose that is associated with sneezing and congestion. And then that clear runny nose after 3 to 5 days is going to get thick and yellow, green and gunky, like you're saying.
Yep.
And then that is going to last for another 3 to 5 days, where it then changes into a postnasal drip that perpetuates the cough for the rest of the 2 weeks.
Yep. Okay. So the next point is, you've said postnasal drip. Now, there's this notion that the postnasal drip makes the chest worse and coughing, and some moms will come and say, please do something to stop it going to the chest. The answer is you can't.
Yeah.
Because the virus is causing the issue. And the virus that is in the nose, because the lining in the nose and the lining down the rest of the airway is the same type of lining, the virus loves it. So the virus will go down the nose. The virus will irritate around the vocal cord area. It's going to irritate the upper part of the airway, which is sitting just behind your breastbone, called the bronchus. And it's going to make you cough. Doesn't mean it's in the lungs. It's part of the upper respiratory infection.
And also when that fluid runs down the back of the throat, because there's dry-ish air going up and down, it's going to get a bit more thick and dry and sticky.
100%.
And that's what makes that thick when they're breathing.
Exactly. And because the nose is so blocked, the children will spend more time breathing through their mouth. And when you're breathing through your mouth, you're breathing in dry, unfiltered air into the back of your throat, which is going to make your throat sore.
Yes.
And it's going to do exactly what you just said, make what is already quite thick, sticky mucus dry, drier and sticky mucus. So, and that's what perpetuates this coughing. And the last part, I think, of the process over that 2 weeks is that as the child starts to get a little better, the cough is often worse as they're going to sleep and as they're waking up. And you can imagine that if you've been lying there asleep at night and you've got this virus producing mucus, but you're sleeping and it's like,
you're lying down.
Lie down. And the mucus is lying there, it's getting more and more and more. And the moment you roll over and take a breath as you wake up,
in the vocal cords.
Yeah, and there it comes. And then you just cough and cough and cough. So that is quite, it's unpleasant for the child, it's unpleasant for the parent to have to deal with, but
it's not in the chest.
It's not in the chest, exactly. I think this idea, this is a good one that we can teach like we just said in the fever podcast, something plus, is that always look for the runny nose plus.
Yes.
So if it's just a runny nose, well, it's just a runny nose. If it's a runny nose plus fever, we've given you the most common cause for that. If it's a runny nose plus difficulty breathing, a runny nose plus screaming in pain, possibly those are things to go, hang on a second, maybe we need to be looking at something, because through this process, no matter what you're going to use, all you're doing is helping the child handle the symptoms of the blocked nose. You're trying to thin out the mucus so it's easier to run down the throat or to be blown out or sucked out. It's alleviating the cough that's there, not stopping the cough, making the mucus a little thinner, drinking hot liquids, using something to make the mucus thin in terms of a medication, making sure the air is maybe a little bit humid. All of those things that are there not to stop or treat the virus, but to help the child deal.
Just symptom control.
Absolutely.
And I think it's very important to say that if your child's nose gets thick and yellow, green and gunky, 9 out of 10, they do not need an antibiotic. If it's a viral infection. If it started as a clear runny nose that then becomes yellow and green, thick and gunky.
Yes, that's right. So I say to the moms, the reason it's yellow and green is because it's been there that long. It's like 2 or 3 days of it and it's there and it's thick and it's sticky. It doesn't mean that you need to get an antibiotic. No. And teething doesn't cause any of this either. Let's just reiterate this. Teething does not cause snotty, congested, runny noses. It is a virus that your child has picked up from somebody else because these viruses are that common.
Yeah. I think that's everything. We went through why is the nose runny, symptoms, and upper respiratory tract infection. We are definitely going to be talking more about when to be concerned about a runny nose, and that's in part 4. But next up, we are going to be talking about the treatment that you can actually use to help your child through their infection. So that's non-medication and medication. So if your children have allowed you to, thanks for listening.
Thanks for listening. Thanks for listening. If you found this of value, please be sure to sign up to our email list at www.careforkids.co.za, and that's the numeral 4, and subscribe in your favorite podcast app or follow us on Facebook.
At 2 Peds in a Podcast.
At 2 Peds in a Podcast.
TWO, not the numerical 2.
This is our disclaimer. The information we have given you in this podcast is our own personal professional opinion. We're giving it to you for your own information. Please don't use it to treat yourself or to treat anybody else. Rather, go and see your own medical healthcare provider and follow their advice.